I just want to use this opportunity to share with you um, a very misunderstood disease within the population, particularly of African descent, and that is kidney diseases, aka kidney failure. Kidney disease does not necessarily mean kidney failure. And you have thousands of diseases that can affect the kidneys, and one may ultimately die from kidney failure or the kidney disease. The demographics in United States, in reference to the most common cause of death among adult men and women, heart disease is said to be number one. And sometimes, without dissecting it very carefully, we misunderstand that to mean that other organs don't kill as much. It is almost rare for you to have serious heart disease that does not eventually affect the kidneys. And the kidney diseases, as we know them, they are broad, and anything you put in your mouth will be absorbed through your digestive system into the blood. That blood circulates in your body from the heart to the rest of the body, particularly the kidneys. So anything you put in your mouth that is toxic eventually affects your kidney. And when the kidney fails, it isn't necessarily kidney failure that ultimately will kill. Sometimes people think that the treatment of kidney failure is dialysis, but it is not, because the average lifespan of people on dialysis is about 9 years. Very few people will live up to 30, 40 years on dialysis. Some will die within months of starting the dialysis, but the average is 9 years. The treatment of kidney disease or kidney failure, if I may say, ultimately when the kidney fails, is kidney transplant and not dialysis. Dialysis is a bridge between the kidney failure and transplantation. One important thing to note is that the kidney basically is involved in processing all the things that happen in the body one way or the other. For instance, if your kidneys are not working well, your bone marrow is not going to be able to make enough blood. Therefore, you are going to be deficient in your blood volume, which is called anemia. And when you have anemia, that anemia becomes very serious. Eventually, it's going to lead to heart failure because the heart is going to pump more in an attempt to give you more blood, but that's not the solution. The solution is to correct the kidney problem. And if you can't correct the kidney problem, the chemical the kidney produces that helps bone marrow make the blood, you can then give it exogenously to the patient, which means you can manufacture it in the lab like any other medicine. It's called erythropoietin, and inject it into the patient. And then that patient will be able to make his blood. The kidney also supports your bone structures. So when the kidneys are not working well, all the vitamin D's that you need and calcium that you need in order for your bone to be strong, they'll be deficient. And when they're deficient, your bones will be weak, and eventually the chance of you having fractures very easily is there. And there are other forms of bone diseases that the kidney failure can cause outside of this kind of fracture that I just described. The same kidney, if it's not working properly, It's not going to let you filter the water that you drink, and then the volume of your blood is going to be much more than you need. We call it volume overload. And then your heart will start struggling because it has too much volume to pump. And eventually, the heart may fail. So it is important for us to understand that kidney failure does not start the day you notice the symptom. Kidney disease could start 30 years ago and you don't even know that you have any problem. The earliest form of detecting kidney disease is finding certain protein we call microalbumin in the urine. Once we see that, we know that the kidneys have an illness. And you start treating it at that point. You don't wait until the kidney actually fails. So the reason I'm sharing this with you is that the kidney is a silent killer. It is, in my opinion, back home in Nigeria, it competes with heart attack or heart diseases as the commonest cause of death. Why? Because diabetes is very common within this population, as well as hypertension. And as we know, in America, almost 25% of patients who are on dialysis, who have kidney failure on dialysis, is as a result of diabetes. And then we know the other 25%, as you know, this is average, will come from hypertension. And then the rest of the diseases will divide the other 50% left. Therefore, hypertension and diabetes are very common causes of kidney failure as well as heart disease. So the heart and the kidneys are linked, they are interwoven. It's almost difficult for you to separate one from the other. So that if somebody dies from heart disease, you pretty much can know that that person, if you look very carefully, has kidney disease. Most patients who end up in intensive care unit as a result of whatever illness, some will develop what we call acute tubular necrosis, which is a kidney disease. And it's almost like 25% of patients ending up in ICU end up having acute tubular necrosis. And of these 25% that develop acute tubular necrosis, majority of them end up dying. Because by the time you develop acute tubular necrosis, you would have had another organ that will fail. We call it multi-organ failure. And if you have one organ failure, like acute tubular necrosis, while you're in the ICU, you run the risk of dying 25% of the time. If you have two, 50% of the time. You have three organ failure, almost 75% of the time in multi-organ failure. So kidney disease is something we need to pay attention to. It is the killer, one of the two major killers in Nigeria and within most population of African descent. Therefore, it doesn't give you a warning when it starts. So the quickest way to know if you have one is to make sure you have a habit of seeing your doctor at least every 3 to 6 months. If you are 35 years and above, if you are less than 35 years and above, as frequent as your doctor recommends to you. And as a disclaimer, I am not telling you when to see your doctor or when not to see your doctor. This is just medical information. I'm not your doctor. If you need further information, please speak to your physician so they can direct your care. This is just a community service, which I'm trying to inform the public that kidney disease is a silent killer. And the most common things we see causing kidney disease, usually diabetes and hypertension. Infectious diseases of any kind, particularly in Africa, also contribute immensely to kidney failure. So I hope you take this very serious. Even people who are using certain creams to bleach their skin, some of the deadly elements in those creams can be absorbed through your skin, end up in the blood, and then affect the kidney. So take care of your kidney by visiting your physician very early and making sure that you follow recommendations, both the diet and non medical modalities such as exercises that your physician may recommend to you.